Hi, good afternoon everyone. I am Dr. Melfred Hernandez. I am an ENT, head and neck surgeon, and I'm here to discuss live when your voice matters most. And answer your burning questions about the voice, about the vocal tract, about speech and voice disorders. The voice essentially, it's a feature of a uniquely human attribute, which is speech, and it conveys emotion, it expresses feelings, it can express itself through music, and it's a carrier of words. So it's very important what the voice is to human communication. And it is also very important, and sometimes we take for granted the importance of voice. It's actually quite challenging when we talk to our patients and advise them to voice rest or to rest their voice, and it's very challenging because it's very difficult to not to talk for a prolonged period of time. That is when we realize the importance of voice is to our daily lives. Voice is the sound produced by the vibration of the vocal folds of the voice box. And speech is more the mechanical act. It is the mechanical act of conveying meaning to the words via your voice, and it encompasses the articulation and resonating chambers of the vocal tract. So essentially, that is the main difference between speech and voice disorders. But for a layman, you can use these terms interchangeably. It's very important to take care of one's voice, especially the vocal cords, because a lot of voice disorders come from voice trauma, voice abuse, and voice misuse. The most common voice disorder is essentially hoarseness due to acute laryngitis or inflammatory laryngitis or infectious laryngitis. And for voice problems related to infectious laryngitis, these symptoms should really just resolve after a week or two. But if you have voice problems lasting for more than a week or two, it is highly encouraged to go see a professional, especially a voice professional or a licensed and an accredited ear, nose, throat, head and neck surgeon to be able to take a look inside your voice box and take a look at your vocal cords and see if it's really more than just an infectious laryngitis or an acute laryngitis. The most common causes of vocal cord problems really pertain to vocal cord abuse and vocal cord misuse and vocal cord trauma. And it's very important to be able to address these issues. It's very important to inform and educate patients on what to do to be able to avoid conditions that may lead to potential vocal fold pathologies. Maybe we can move on to some of the questions from social media. The most common symptom, clinical sign, is hoarseness or change in the voice or dysphonia. It can range from hoarseness or breathiness of the voice. It can be vocal tremors, vocal fatigue, that is difficulty in talking over a prolonged period of time. There can be changes in the vocal range and pitch problems. There can be a lot of breathiness and a lot of turbulence in the voice, especially in the background of voice abuse and voice misuse. If you are a professional voice user and you use your voice mainly in your career, then you should be very careful about vocal hygiene, and you should always make it a point to see your ENT specialist, especially after voice problems lasting for more than a week or two. With voice problems for less than 2 weeks, this is really just mainly attributed to an acute laryngitis. But should you have voice problems more than 2 weeks, especially if you have a lot of risk factors, then you should definitely and immediately see an ENT professional, most preferably a voice professional involved in voice care and voice surgery. Of course, you have to understand that phonation or voice production doesn't really just involve the vocal cords. For production of voice, rather, you should have a voice generator, which is the lungs, okay? And you have a vibrator, which are the vocal cords, and you have the resonators and articulators, which involve the mouth, the throat, the teeth, the lips, and the oral cavity and the oropharynx. In any portion of this entire speech mechanism or vocal tract, you can have problems, and this can relate to problems in the voice. There are a lot of medical conditions that can lead to voice problems. You can have endocrine problems, pulmonary problems, you can have cardiovascular problems. If you have heart enlargement, you can have pressure on the recurrent laryngeal nerve, so that this would cause some temporary paresis or paralysis of the vocal cords and can lead to hoarseness or dysphonia. Essentially, all the systems of the body where the recurrent laryngeal nerve is involved in its tract from the brain down to the neck, down to the chest, and it's in recurrent course up the neck, you can have problems with your vocal cords, with your speech rather. When we put patients on voice rest, we usually advise them to limit their talking. Voice rest is for voice professionals. What I usually advise is voice rest is not saying a single word or singing a single note for which you're not being paid. That is voice rest for a voice professional. Okay? It can also be defined as limiting your talking to about 5 to 10 minutes per hour. Voice rest is also defined as reduction in the volume and the frequency of talking. But we advise patients against whispering. Whispering is not voice rest. Why do I say whispering is not voice rest? When you whisper, you tend to make your vocal cords open and not completely closed during vibration. Okay? And when you do that, keep it slightly open, and then the supraglottic structures, the structures above your vocal cords, are shifted downwards. It is a very tense situation in the vocal cords when you whisper. What do I mean by this? This is whispering. When you whisper, you tend to tense up your vocal cords, and all the structures above your vocal cords are shifted downwards. Do you see what I mean by whispering? It's not a relaxed state. It's a very tense state rather, versus use of a confidential voice. Confidential voice is like this. Confidential voice essentially is what you use when you want to speak to someone in confidence. Like, if you have to speak to someone in confidence, this is the voice that you would want to use. Okay? That is confidential voice versus whispering. Whispering is not at all recommended. Okay? Especially when you are whispering in voice rest, when you have been whispering for a long period of time, it gets to be very difficult to shift to the normal mode of talking, so that this would really cause a lot of problems and a lot of possible pathologies, further pathologies to your vocal cords. Actually, yes. Especially life-threatening vocal cords. I think it's better if I show you a picture or at least a video of. This is a picture of your vocal cords. So these are your true vocal cords. These are your false vocal cords. This is the area of the tongue, and this is the area, the inlet of the esophagus. And this, essentially, the vocal cords is the entry. It's the inlet to your airway, into the trachea and into the lungs. Okay? If you have any obstruction to the vocal cords, if you have any pathologies in the vocal cords, that would translate to voice problems. But if the obstruction is such that it would significantly occlude the entrance to the airway, then you would have breathing problems already. And when you can't breathe, that is a life-threatening condition. I'd like to play to you. So these are your vocal folds in action. When you are phonating, your vocal cords come together and they vibrate in the midline. That's you breathing, and when you vocalize, your vocal cords come together and the vocal cords open and close in the midline. If you have anything at all here on your vocal cords, if you have swelling, if you have a mass on the vocal cord, if you have paralysis, if your vocal cords don't move normally, then you would have voice problems. Okay? I showed you this because if you have a lesion on the vocal cord, if you are a smoker of several pack years and you develop hoarseness for more than a month, okay, and you fit the picture of a patient with risk factors, you should highly suspect that you might have a neoplasm or even a tumor or a malignancy on the vocal cord, and that is really life-threatening. I'm a little biased with this because okay, I would say that if you have a voice disorder, you should immediately see your doctor or your ENT specialist. But you just have to note that the trend really now is to do a multi-specialty approach to the disease, a team approach to the disease. An ENT specialist is primarily a doctor or a medical doctor who underwent another 4 years of specialty training to become an ENT, an ear, nose, throat, or an otorhinolaryngologist, and an head and neck surgeon. And there are some of us who further go into subspecialty training. Like the study of the larynx, the study of the voice, care for the professional voice, phonosurgery, and phoniatrics. A speech-language pathologist is an allied medical profession who underwent training, is not a medical doctor, but is a very important component or very important team player in the team management approach to voice problems. Let's say you have a voice problems you're a teacher and you've been complaining of voice problems for several months now. The usual course would be for the teacher to see a doctor, see an ENT specialist, and then the ENT specialist would perform a complete physical history, a complete history taking, perform a complete physical examination, and then focus the examination on the examination of the vocal cords. Okay? And After which, if a diagnosis is made, let's say a patient has vocal cord nodules. Nodules usually are, you might say in the layman's term, these are calluses on the vocal cords or callio on the vocal cords. And this is mainly brought about by continued voice use, voice misuse and voice trauma, voice abuse. These are symmetrical swellings or nodules on the vocal cords. After being evaluated by an ENT specialist, the usual course, the normal course, should be for the doctor to refer or to call on the speech-language pathologist, because treatment for vocal fold nodules is not surgical at all. It's voice therapy or speech therapy. It's a very conservative approach now. Okay? The patient should be sent to someone trained to evaluate what is wrong with how the patient is producing his voice, from the voice generator, from the voice vibrator to the articulator, to correct all habits, voice habits that contribute to this dysfunctional voice production. And this is where we have our speech-language pathologists to care for these particular patients. And speech-language pathologists are also very helpful in our practice. Even if patients are supposed to undergo surgery for pathologies, it's very helpful and it's ideal to have them go on speech therapy or voice therapy, even pre-op and post-op. Singer's nodes are usually, as I said, as what I had discussed, these are usually vocal fold nodules. They're also sometimes referred to as screamer's nodules, okay? And these are managed conservatively with voice hygiene, voice rest, medications, and the mainstay of treatment is voice therapy, care of our speech-language pathologist colleagues. It really depends on what the voice disorder is. Children, we get a lot of screamer's nodules, especially the class A children. They scream a lot, they talk a lot, they're hyperactive. If he has vocal cord nodules, then he has to have therapy for this, and then he can outgrow the vocal cord. But if he doesn't, or he or she doesn't get the help that he needs, and he continues the abusive behaviors, then he will have the vocal cord nodules for life. Okay, I think my take-home messages would be, we all have to take care of our voices. Okay. The best way is to hydrate, take lots of water. There are a lot of dietary restrictions, okay, some of which include, especially if you have a laryngopharyngeal reflux or reflux going, or acid going up your throat, you have to avoid very salty, spicy foods, fatty foods. You have to avoid even citrus drinks, avoid tomato-based products, some dairy, avoid chocolates, avoid sleeping on a full stomach, okay, having your last meal about 3 to 4 hours before lying down or sleeping. If you have any problems at all with your voice, especially lasting for more than 2 weeks, you see an ENT professional. And try to be kind to your voice. I think that's all the time we have for today. Tune in again next Wednesday for another CMI TV Live. Again, I am Dr. Melfred Hernandez, and have a great week ahead. Thank you.